males in our rehabilitation centers than females?
Child care.
Because more males are using drugs. According to the world data, yes, no? According to the world data I presented earlier, 1 female should need access for every 3 males. No? But in the Philippines, we have 1 female accessing facilities for every 14 males. Why is this? What do you think is the reason? Because we only have 2 female facilities in the country right now. No? We only have 2. One is in Bicutan. I think you're all aware, no? Yung Bagong Liwa facility natin. It houses females. No? The other one is in Cebu, in Eversley Sanitarium, Region 7. So if you're a female and you want to access treatment facility, you need to go to a private facility, or if you don't have money to pay for your treatment, then you only have 2 government facilities providing services. One is in NCR, the other one is in Cebu. Another point that I need to emphasize as far as this slide is concerned is the substance use as far as admissions to rehab centers are concerned. Previously, in 2014, the #1 drug of choice as far as those admitted in these facilities are concerned is shabu, followed by marijuana, and then inhalants. In 2015, it's still shabu, no? Followed by marijuana, but this time we have cocaine, validating the 2015 survey that cocaine is already present in our communities. Okay. Just to show you that we have around 44 treatment and rehab centers nationwide, and 16 of those facilities are government operated. The rest are privately owned. No? But we still have 5 regions without residential treatment and rehab centers. So we don't have treatment and rehabilitation centers in ARM, Autonomous Region Muslim Mindanao, Region 12, Mimaropa, Region 4B, Region 2, it's still under construction. We have one in Isabela, no? But it's still not yet operational. And we don't have any inpatient facility in the Cordillera Administrative Region. So we still have 5 regions without existing inpatient treatment and rehab centers. Now, as far as law enforcement data is concerned, I think later on your Directorate for Operations will have better figures, no, as far as the enforcement data is concerned. But let me give you just some of the statistics provided to us by PIDEA. In 2015, the price of shabu ranges from 1,200 to 15,000 per gram. In the same year, the law enforcement agencies were able to arrest almost 19,400 individuals, no, and the following were seized. No? Now, out of this arrest, out of the 19,400 individuals, we filed around 22,000 cases. Usually we file more than 1 case per individual. And then out of that number, out of the 19,000 arrested, 1,822 were considered high-value targets. So what are high-value targets? These are politicians, law enforcers, members of drug groups and armed groups, government employees, and foreign nationals. No? Majority of government employees that were apprehended were actually elected officials. No? Barangay captains, tanons. As far as the law enforcers are concerned, the highest ranking law enforcer that was apprehended was a senior police superintendent. For government officials, the highest ranking government official that was apprehended was a Sangguniang board member, provincial board member. Now, 38 foreign nationals were apprehended, and again, you can guess what country would be the #1 foreign national. China. It doesn't show you, but it's China actually. So, Where are we now as far as the war on drugs is concerned? Now, this is based on ABS-CBN GMA7 data is concerned. This is the death toll as far as the war on drugs is concerned. No? As you can see, from May 10 to actually September 12, this is September 12. This is only up to August. It's not yet updated. No? But as you can see, there is an increasing trend of deaths. So far, as of August 2, 748 deaths. As of September 12, we already have 1,400 plus deaths in the country. Also, to show you the number of surrenderies, this is as of July 29. It was around 532,000, but as of September 10, we already have 690 plus surrenderies nationwide. Huh? Again, your office for the directorate would have better figures. So what are the challenges as far as the Philippines is concerned? Number one, globalization. We expect, because of globalization, and we have already integrated with our ASEAN neighbors, no, last September 2015, with free trade, we expect free illicit trade. So we need to guard our ports of entries. We already have our airport interdiction task forces composed by PIDEA, PNP. No? We are now trying to develop seaport interdiction task forces. Number two is the emergence of new psychoactive substances. As I mentioned, these substances cannot be detected by any drug test available right now in the Philippines. No? Majority of the substances being mixed, being introduced are synthetic catechinones. And we don't have any detection kits for those substances as of yet. I don't know if you're familiar with what happened in SM, your close-up event. 5 persons died, no? And according to the forensic lab report, they used MDMA mixed with catechinones. Again, we also need to address the increasing numbers of persons who inject drugs positive with HIV. As I mentioned, this is predominantly happening in Region 7, but it's slowly expanding in the Mindanao areas as well as in Metro Manila. We now have reported seizures of liquid methamphetamine, and we suspect they will be used by injecting drug users. There is a need to expand access to services. As I mentioned, we only have 2 female facilities nationwide. We don't even have a specialized adolescent treatment and rehab center. If you're an adolescent and you want to access treatment, you need to go to a private service provider. We don't have any government facility for that. It's good to note that right now we already have our Philippine health insurance covering detoxification services in the country. However, we are still lobbying that inpatient programs should be covered by health insurance. No, but they told us that it's too expensive for them to cover, but they're still studying the possibility of covering inpatient programs. Treatment and rehab interventions not subsumed, okay, with continuum care provision. So this is our weakest link as far as treatment is concerned. No? There should be a smooth flow of continuum care from detox to the primary program to the community-based aftercare program and other support services. Right now, that's the weakest link. No, the only available service that we can provide would be the most stable one would be the primary program, no, for inpatient programs. And later I will discuss to you the new algorithm that was developed by the Dangerous Drugs Board to address the number of growing surrenderies. And finally, monitoring and assessment. And I think we are not alone. No? Philippines is not alone as far as this is concerned. Even in the US, they have a weak standard success indicator. No? And globally, the standards are not yet set. When do you say that somebody who underwent treatment and rehab is already successful, is already cured? No? Again, there is no set standard indicator as far as this is concerned. We have varying processes to validate program implementation in the country. For your information, we acknowledge 4 treatment and rehab programs, and I think some of you will be aware of this. I think you're all familiar with the Therapeutic Community Program, the one being implemented in Bikutan. We also have a 12 steps based program, Hazelden, Minnesota model. It's being implemented by some local government units, provincial treatment and rehab programs. No? We also have faith-based programs, and the 4th one would be a mix of all the 3 programs. Again, there is no standard indicator or process of validating these programs. As far as we're concerned, based on international literatures, these are the 4 most effective programs, but we've yet to conduct any evaluation on them. So we're trying to develop the assessment tool on how to measure the impact of treatment and rehab programs in the country. Okay. So this is the National Anti-Drug Program of Action. This is the document which outlines all our strategies as far as drug prevention and control is concerned. No? So basically, what it tries to attempt is to strengthen supply and demand initiatives. If you recall, previously, way back 2005 to 2010, we have what we call the National Anti-Drug Plan of Action, which was implemented during the time of President Gloria Macapagal Arroyo. No? But this time, we have the 2015 to 2020 National Anti-Drug Program of Action. It's a successor document for the National Anti-Drug Plan of Action. This was signed by the previous administration, 2014, and it's still the strategy that we're still following. Okay. So that's it. Let me present to you. Any questions as far as these statistics are concerned? Is it clear? Do we have a big problem as far as drug abuse is concerned? Okay. So let me just review. I mentioned earlier that according to the World Drug Report, around 0.6% of the drug-using population would be problematic drug users. No? So if we talk about 1.8 million drug users according to the 2015 survey conducted by a private organization, if we talk about 1.8 million drug users in the country, 0.6% or roughly, let's round it up to 1%. No? 1% of 1.8 million would be how many?
180.
Around 18